medicine and surgery specialty. Then we can have, and allied, we can talk about the physiotherapists, which is trying to come on board and people coming to appreciate. We can talk about the laboratory scientists and technologists, the dentist, and of course for pharmacy, we can talk about all that fall under them. And the nurses also have specialization and the midwife like those of the medical doctors. The situation also, as far as Uganda is concerned, is that now we have various levels of education, starting from certificate up to PhD. Our universities are offering PhD educations and our other education institutions, meaning that we have certificate education, we have diploma, we have bachelors, we have masters, we have PhDs, but also we have fellowship training for certain specialization. The other status that we must appreciate is that as far as facilities are concerned, we have facilities that are known as public facilities. We have facilities that are known as private for profit. When you talk about Nakasero Hospital, Platinum Medical Center, then you have those ones that we call private for profit. But also we have facilities that we call private not for profit. And these are mainly faith-based facilities like in Zambia, Lubaga, Chibuli, and so on. However, these facilities also vary as far as specialization and levels are concerned. When we are in the public, we boast about health center too, up to national specialized hospital. And the setting may not be very different from the private one. So they tend to fit in, is it a health center too? Is it a health center 3 facility? Is it a regional referral hospital? Is it a national referral? Or is it a specialized hospital like now we have Mulago Hospital? Or is it a woman specialized hospital? Is it Uganda Cancer Institute or Uganda Heart Institute and so on? So all that is happening in Uganda as far as facilities for service provision. And I want to say that as far as health profession, their remuneration by government is good. And even the opportunity for work is also available within the country and even outside. Many of our people have gone abroad to serve in the various capacities as health professionals. Now, I want to talk about admission or entry into health education institutions. And I want to say that ideally, there must be an intention for somebody to become a health professional. You don't just wake up, although experience is starting to show to us that sometimes students come in because their fathers, mothers want them to be health professionals. But the idea would be this person having an intention of becoming a health professional right from basic education. And therefore, if that's the case, this person will study courses or subjects that will lead him to get what we call the minimum entry requirements. And majorly we focus on physics, chemistry, biology, mathematics, and English. Biology being the core subject and chemistry as far as clinicals are concerned. And if you don't have them, then you may not be able to do any course that relates to that. But also, especially for university and as tertiary institution, we have a concept we call cutoff points. You may have passed, but if you have not worked well, then the points will cut you off and you'll not be able to be admitted. And then the others, the interest, you apply and you do the interviews and so on. So we have what we call PUJAB for government-sponsored students in public universities, but also we make the private list, which we again make after we have done the government list for public universities. But also we have the JAB admission, joint admission board for tertiary institutions. And also there will be a private list made at tertiary institution level for private sponsored students. And then for interviews, we always advertise and invite suitable candidates to apply, and then they sit on interviews and then they are selected to attend. What I want to say that for all these students, like I told you earlier, must apply must apply, whether for Punjab or for JAB, must show interest that this is what I want to do, and that's how will be selected. For private institutions have their individual policies of admissions. We have private institutions that open admissions throughout the year, but we also have private institutions that have specific period of when they are getting new students and so on. In all this, as far as health education and training is concerned, there are specific standards that are put in place. For example, the frequency used to admit. And majorly for these lower levels, they are admitting twice a year, but not to have double admission. And then for the others, also it is once a year. So even if you are getting students showing interest throughout the year, but there is specific periods when they have to report to the school for admission. The other thing that I want to talk about is to find out, is the situation satisfactory? Is the situation okay? Are we in beds of roses as far as health profession education and training? And the way you tackled this, I think in this room, there are people who are as young as I am, who are here around the 90s and before that time, that know that during that time, health profession education was fully funded by government. You would be admitted in an institution, you are given free accommodation, you are given free food, you are given an allowance, uniforms are provided to you for free, and everything was for free, that your responsibility was to sit in the classroom and study. I'm even told that those people who are more younger than me, who were there before me, they were even beds were being made for them, clothes being washed for them, and so on, meaning that there was no stress as far as education is concerned. But business have changed. Now, students have to apply, as I've told you, they have to pay fees. Whether you're in government or private, government students pay what we call functional fee. Then the private students even pay more, a lot, and it is expensive. And to me, I feel that this causes a lot of stress in the students as they are learning, because they have to think about when and how can I raise the fees, and how can I settle in the classroom and study. The trainers, again, you know, when we look into the Hippocratic oath and the commitment that you make when you are qualifying, that I will continue support this profession to continue to grow, and therefore, willingly, I will be teaching the new people that are coming into the field. Again, that has changed. We have a few that still have that positive attitude, but as I say, if you want me to teach you a student, facilitate me. This is a service I'm providing. And again, this brings a problem as far as the training is concerned, and make the situation not to be satisfactory. Then the rapid change in technology, we see technology changing every day, every second. Before, we are using more traditional analog approach, longer cases, short cases, visiting the patient, and so on, physical and so on. Those days have changed, that now we have telemedicine, have various advanced technologies. I am a midwife by profession, and I want to talk about, before we had natural fertilization, now people are conceiving through other various ways. And of course, even the operation, now people are being operated without a wide wound made, and so on. So all this, we need to appreciate, that has made the situation not to be satisfactory as far as the country. Maybe we are not yet there as far as technology, maybe we are not there as far as digital facilities and so on. And that makes me to wonder whether it is satisfactory. Members also wanted to speak about these emerging diseases. And I know all of us now appreciate when we talk about emerging diseases, because Uganda has gone through Ebola, Uganda has gone through COVID-19, and all these put pressure on the review of the curriculum, put pressure on the available infrastructure, and therefore need for improvement of such infrastructure, and the provision of resources for training and the methods of training. And when we were in COVID-19, all of us first ran off. There was no student in the training institution, and therefore that made challenge the training somehow. And when we came back, we reduced the numbers, and the space was who require the white spaces and all the other PPEs that we are looking at. All this make the situation not to be satisfactory and to make us to think otherwise. And then the population is now more informed. When you feel a symptom, you can go on the network, you Google, and you get the reason why you are behaving that way. And by the time you go to the hospital, you have known what condition you are suffering from and how is it going to be treated. And that makes, again, us to appreciate whether the situation is satisfactory or not satisfactory. Now, what are we doing? What are we doing to see that we improve the situation? One of the things that we are doing is, one, we are developing a policy that is going to provide a framework for training of health professionals. But also we have other regulatory frameworks that are in place that have been guiding the training as we move on. And all these are focusing on admission. How do we admit? What do we admit? And when do we admit? And so on. Then access, where can we get such services when we want them for training and development of health workers? The training, what type of training are we getting? And where, and so on. And then the curriculum, now we implement what we call the competency-based curriculum. And this is what we have been doing since time immemorial, because we want somebody to get out when he has a skill to practice. And then the trainers, the facilities, the issues of clinical rotation and internship, and issues of continuous professional development, all this we are working on them, and we want to see that they are done well. Then we're also looking at standardization of curriculum, especially for national diploma and certificate programs. Unlike other sectors, other professionals, for health professionals, if you are doing a certificate and a diploma, it must be a national recognized curriculum that can be offered anywhere. We discourage having institutional specific curriculum for health professionals, for certificate and diplomas. And then for the degrees, masters and PhD, and as we know about the academic freedom for universities and so on. Here again, individual universities develop their own curriculum, but there are those core competencies that must not be missed out if you are training a medical doctor, if you are training a pharmacist, and so on. So that's what we are doing right now. And we have, of course, Ministry of Education and National Council for Higher Education guiding this. We have established quality assurance bodies that I have just talked about. We have now national health examination boards. We have the professional councils that regulate the practice, including that of the health trainers and the associations. We have the National Council for Higher Education that regulates higher education. And then we have the Directorate of Educational Standards that inspects institutions for stability and so on. Of course, we still have internship, and this one is not going anywhere, for all clinical graduates that come out from our institutions, from our universities. And this is aimed at supporting the confidence and hands of this trainee who has just graduated, that by the time he gets out of that training, is confident to deliver. And it is highly supervised. It is highly supervised because we don't want any error as far as clinical provision is concerned. And then there is close supervision, monitoring, and evaluation that we are doing. And both Ministry of Education and the Ministry of Health are involved in this. And then continuous capacity development, which might be within the organization where somebody is working, or it might be a longer-term training, a master's, PhD, fellowship, and so on. We are working on improvement of infrastructure to cater for the emerging demands that keep on coming on board. And of course, we have opportunities like the higher education loan to support the students who are looking for fees to study, and then after studying, they pay back, and then we continue supporting others. What are the challenges that we have as far as education is concerned? One of them I've already talked about, limited infrastructure and other resources, especially the training resources. Sometimes it is not adequate, both in the institutions and the hospitals. Because of the high demand on these resources, our population keep on growing and limiting and putting pressure on available infrastructure. Limited supervision and monitoring, and which again tagged to the available resources to support that activity. Then a poor attitude of the trainers and the trainees. Like I've already told you, the trainees that we are getting, some of them, they think that what they are coming, they don't know that health profession is a vocation, it is a calling. It is a lot of sacrifice that you have to endure and provide the services. It is not bed of roses. So their attitude when they come in, they think that maybe they are coming to do something easy where you can run away in a second and so on. But in health profession, when you run away, when you miss 6 minutes, you can lead to somebody to die. So all this is an issue that we have to get a strategy of working on. Then the lack of enough trainers, consultants, clinical mentors, health tutors is also another issue, and lack of compliance to set standards, especially the private sector that is coming into the game of training. And here the issue is for us, as far as training is concerned, we want quality. And then the private sector will say, yes, you want quality, but I want the profit. And this tends to mix up. But all in all, we want the standards to be observed. Then negativity, confrontation. Sometimes there are things that happen, but also it needs to investigate and appreciate them. However, in many times we see people quickly judging. They quickly judge and they don't listen. And by the time they listen, the harm has already been caused, and therefore somebody may not be in a good position to manage accordingly. The rapid change in technology is another issue that I talked about, and therefore we need to be ready to manage that. So what is the role of Rotary? I want to say that Rotarians put on various caps. Rotarians are parents. Rotarians are health practitioners. Many of us are Rotarians, but also we are health practitioners. Rotarians are policy makers and implementers. Rotarians are economists who have to appreciate that training of a health worker is an expensive venture, and therefore resources must be provided. And we have Rotractors and Rotarians who are still students, to mention but a few. And therefore, because of this, we need to look into how we can come in as Rotarian to support health profession and education. The first way is the qualified trainers who are Rotarians should serve beyond self when mentoring the trainees. We should advocate for better training, for quality training, for adequate training, for having adequate numbers as far as training is concerned. We should support the various programs like I am happy that Rotary do support maternal and child health. Rotary do support disease prevention. Rotary do support the safe environment, and there we're going to the public health, the WASH programs, and so on. All that we should fully support and see that as we are supporting those programs, we don't forget that the people who are working were once students, and therefore we need to support the students that are there. We need to provide positive feedback to the trainers, and of course, even to the trainees. We need to strengthen and initiate mentorship programs for trainees and the trainers. We have the Rotract class who are institutional based in Jinja, in Molago, and other training institutions. As Rotarians, let us support those trainees who are in those institutions positively to see that they deliver. And we have to collaborate with the government when we are working and supporting training. Ladies and gentlemen, I want to thank you for listening. If there's any question and supplement is highly welcome. And I have done this for God and my country, Uganda. I submit. President, are you hearing me?
You were allowed and clear, Dr. Safina.
Yes, I was not hearing any response. I was wondering whether I was speaking to myself.
No, you were loud and clear, very loud and clear. To the point.
Yes, Dr. Safina, you are loud and clear. If it is okay, let me invite, for purposes of time management, and invite our own Rotarian Anthony to take us through the question and answer session. Anthony, the floor is yours. You have 10 minutes.
The president is muted.
Okay.
Someone to unmute.
Thank you, Rotarian Jen, and good morning, Rotarians, directors and guests, and all those on call. Wow, what a very wonderful presentation in such a short time from Dr. Safina. Hello, Rotarians. For the question and answer session, you're free to type your questions on the chat section, or you may raise up your hand so you can be asked to unmute and shoot your question, or you may also read the Chichiga way, just unmute and shoot. Already from the comment section on the chat, I see a comment from Rotarian Richard Kalunji. It says there is a concern about mushrooming nursing and medical schools and dwindling the quality of medical professionals. The National Council of Higher Education seems to have slept on the job. Dr. Safina, you may make a comment on that. And he also goes on to say that today nursing has been largely left to students who perform poorly or fail at senior 4 and senior 6. You can imagine healthcare provision being left to be made taken on by the hands of worst performing students, which I think is a challenge that we face as a country. Dr. Safina, you may comment on that as people prepare the questions.
Dr. Kalunji, thank you very much for that question. As you may recall, when I was starting, I talked about those days. I also talked about the private sector coming into education. And this was after the 1998 World Bank report that rationalized, but also liberalized the provision of educational services. And therefore the private sector came in. And of course, anybody, once he has the facilities and the resources, can offer health professional education. I do take the note of the mushrooming institution like Dr. Kalunji is saying. I also want to appreciate that as far as the population of the country, we haven't reached to that level that we have adequate training facilities. I just want to give an example of the recent recruitment that we had. We have over 10,000 students that had qualified to join the institutions, but the places that were available were only about 3,000 to cater for them. So you have an admission and you only have opportunity for 30% of the students that are intending to join the training. However, I do take note of the issue of quality, and that's why I told you that the government is working on a policy that will tighten. I know they are already practiced on the board. We have National Council, and you saw National Council closing some of the universities because they are afraid to comply to qualities. All that is being done. You always hear us closing schools and institutions. So you have heard of the East African Community councils, professional councils coming to Uganda and also checking on the standards and so on. So everybody is concerned as far as standards and quality is concerned. But also whenever somebody starts an institution, must have all the resources that are required for training, including the trainers and the clinical facilities for training such professionals. That's what I can talk about that. Dr. Kalunyi, thank you very much for the question.
Oh, thank you for that comprehensive response. I see another comment from Rotarian Walakira Boja. That's so good, PhD Safina. Thanks a lot. What a good opportunity to have with us. These are the opportunities of being a Rotarian. You are visible and approachable. May God bless you abundantly. Okay, Rotarian Helen Nantes is asking a question. Is there a ranking of the nursing training institutions? And two, how do we know which of the best training schools there are? I had a hard time to select a school. I sought advice from the registration board and selected a school in Jinja, but I am not so happy with the school. And there are many demands from the school. I think Dr. Safina made a comment on the cost of training of health professionals. So, but Dr. Safina, you may go ahead and respond to that concern from Rotarian Helen Nantes.
Thank you. I even saw her hand going up. I don't know whether she wanted to talk about it herself, other than for us. Maybe she might even make her concern more clearer. My Dean of Ages.
Rotarian Helen, you may go ahead and unmute and shoot your concern.
Okay. Thank you very much. When I had it read out, but thank you very much, PhD Safina, for the good presentation. Yes, my question is about the ranking. For example, for universities and for secondary schools, there's a kind of ranking. You have an idea which school performs better. But for the nursing schools, it's difficult. When I was looking for a training institute for my daughter around a year or so ago, I had to refer to that training to the registration board because I had a colleague there in the communication field. But she gave me some options and I chose one school. But I'm not so sure that I made the right choice because you don't know which one is the best and which one is not. And then the demands are too many. They don't give anything there. You pay school fees and they ask for money for this, money for that. But then most importantly, is there a ranking criteria for these institutions so that we can know this one is the best, this one is the second best and something like that. Thank you for that very good presentation. Thank you.
Thank you very much, PhD Helen, for that question. Indeed, as far as ranking, we are a bit hesitant to rank even the health professionals. You say awarding and classified awards, and even the facilities, other than saying health center too. If you go to health center too, you get such a service. Or when you go to a certificate institution, you get such a service. But I can hear you. I think internally, we need to see, and these are the innovations that we can look into. We have created, since the last 2 years, we started a national conference which brings on board trainers and care providers. And the last one was in Tebe about 2 weeks back. And at this conference, so many things for training are discussed. But still at this conference, we are recognizing the best principals and the best tutors, the best preceptor from the hospital and so on. The message that I'm getting out of you is that we should go beyond recognizing the best, but also we recognize the best institution that by the time we reach that, we would have ranked them. So we have a concept of centers of excellence and we are planning to implement it for the future. I'm really sorry and I need to know this institution, but one thing that I want to appreciate is medical or health profession education and the training is very expensive. One, we use real patients and lives and we go into an environment where there is disease and sickness, and therefore the person that is going there must be healthy, with good immunity, with protective gears, and so on. And all this makes the training quite expensive. But we also said that let us have a standardized list of the items that we attend the parents and the students to pay, and then people appreciate what is going on. PhD Nantes, I will request you to make me understand this institution, and I may do something to improve.
Right, thank you.
Rotarian Tony,
CP
I give you only 2 minutes.
Thank you, President. CP Totoket Baraza, I see your hand is up. Please unmute and raise your question.
Yeah, thank you very much, my son Tony. Thank you for the great facilitation. Just in a second, first I want to thank PhD Safina very much for defending her classification very, very well. As your former colleague at the ministry, I do confirm that you have given it your all. One of the milestones that I think government has achieved is bridging the gap, the gender gap in the nursing profession. And every year we see an increase of young men or boy children applying and completing the nursing training. My question, PhD, is has there been any tracer surveys or studies to see how the men are performing in this traditionally female-dominated profession, so that we use that as an opportunity to think through the policy development again to attract more men to join the profession. Thank you so much. Back to you, Tony.
Thank you. Dr. Safina, before you respond to that, there is another concern from Rotarian Peter Paul Opata. He says he's had a chance to receive medical services both here at home and overseas, but here at home, the approach to the patient care and honestly everything besides the infrastructure is different. His question therefore is, are our health workers just poorly trained, or it's the workload and poor pay that is the issue?
Okay, thank you very much. Thank you very much, Tony, for those two questions. I just wanted to respond to the gender. Yes, we have now male coming to the training. And I want to say that the performance is equally the same. Performance is equally the same once they are trained. The boys will perform equally like the girls. And you find a very good female health practitioner, and you find a very good male practitioner. So this is the same as far as the training is concerned, but all in all, we can do a study to compare. The only thing that we have done is to see that the population for the male, because previously we had the population of 1 to 3, but that gap is now being going, we are going towards to 40% to 60% as far as male for the female-dominated practitioner. We have also another side of the coin that we have, especially for the allied, which is more male-dominated. There we are still struggling to get the female child or the female student into those areas. But all in all, education is about making the gender disparity managed and having equal opportunity for the two genders. That's the position of education. I didn't answer the question of Dr. Kalungi of having failures from senior 5, senior 6 joining the profession. And I do talk about the policy that is under development. And to cater for this, yesterday I was having an argument, before we did not have very many students that come and do the 2-3 years, and then they fail to satisfy the requirement of the profession. But this year we have had students that have completed the 3 years and we are training them, you have exhausted your opportunity of training and therefore you cannot be a medical practitioner. Go and do other things. And the argument that the trainers are telling me that because the entry requirement might be weak, and that's why we are reaching this stage. So as education, we have taken note of that, and we are working on it, and we hope to get the best solution out of it. And then I've not got the question. What was the last question? Remind me. Who are the...
The last question was a concern on the kind of care received from the medical professionals, whether is it a gap in training or it is the remuneration.
I wanted to answer to that question related to COVID-19 pandemic. If we appreciate the experience we went through during COVID-19 pandemic, where all the services were only provided by our health professionals, and we saw the results that came out, that can enable us to answer that question. I thank you, Anthony.
You're welcome. Okay, over to you, President. Dr. Safina, I request that you'll give us some more time on the Chimeza, because there are still a lot of questions on the chat section. Thank you.
Thank you, Rotarian Anthony, for taking us through the Q&A. Thank you, Dr. Safina, for presenting to us what we expect from the medical practitioners. Indeed, there's still a lot to be desired. We still feel there's a gap. We still feel there's more to be done by government and by the individuals on how to improve on the healthcare. But we thank you for everything that you've given to us. You've informed us on the expectation, and I believe that will make our lives better. At this juncture, I request the Sergeant at Arms to give us some 10 more minutes to conclude this fellowship. Then I'm also requesting Daybreakers to stay behind for 10 minutes after the fellowship so that we agree on our service project of Saturday. Thank you. Thank you. Allow me invite Rotarian Dr. Honorable Rutaji to give us a vote of thanks. Is Honorable Rutaji in?
Loud and clear, therefore. Can you hear me now?
Yes, I can.
Wonderful, wonderful. President, I want to thank you very, very much for a number of things, but time will not allow me to go into them beyond saying that thank you for presiding over a wonderful fellowship. Thank you very much for inviting me through Jane, Rotarian Jane. I would have regretted if I had missed this fellowship. And I thank you for managing the Rotary Club of Kampala Daybreak, which is an excellent performer in the district. I am the charter president of the Rotary Club of Kampala Daybreak, and I always get messages from Rotarians asking why I am charter president, and yet I am absent in action. Yes, I'm charter president, and once charter president, you will always be charter president, even when I have gone to meet the Lord. Rotarians, the new ones, should be told that. And when I finished my tenure, I was advancing in age, and according to Rotary policy, which I hope has not changed, under Rule 85, if a Rotarian has reached an age, a certain age, and you have been in a Rotary for a number of age, if you add the two and you reach 85, you are allowed to live and remain honorary and honorary Rotarian. So new Rotarians who don't see me in Daybreak, it's because of that policy. President and Rotarians, I am excited about Daybreak, the way you are performing very, very well. I always get reports. At the time when Daybreak was started, was a time when Uganda had already qualified to be a district. And I and the late Sam Woli were advocating for a monogamous Rotary district, Uganda, because we had over 30 Rotary clubs in the mid-80s, by mid-80s. And at that time in the Rotary world, if a country or a region had reached that level, you could become a Rotary district. But in Uganda, it did not happen. And this is why we're advocating for the status of a district until recently, much later, when now, because of the expansion, the late Samuel Woli and myself spearheaded, we were overqualified actually for one district. And now we are becoming two districts, which I call a polygamous district, Uganda. And Daybreak has played a big role. And congratulations, I commend people like Richard Masereji, I hope he's still a member, Kaswarira, and many others, Fred Kibedi, Basima, and many others who spearheaded the growth of Rotary Club of Daybreak. Now, over to our guest speaker, Dr. Safina Kisu. You have done a fantastic job. As members have said, you are a wonderful lady. You are a scholar. You are a punctilious medical worker, an educationist. You are professional. You have given us an eloquent presentation, and we are all very, very much blessed. Especially me, for reasons I've already stated, but also the fact that I'm a past medical worker. I'm the past general manager of National Medical Stores, my last session of work before I retired. And while I managed that institution for over 6 years, I came in contact. I interacted with the medical professionals of all levels, and I put a stamp, I confirm all that I have shared with the Rotarians. May Allah, Almighty Allah, God the Father, God the Son, and the Holy Spirit bless you in your profession, and may you prosper. And President of Rotary Club of Kampala, may you also prosper as you continue to lead the great Rotary Club of Kampala Daybreak. God bless you and have a blessed week.
Thank you, Dr. Robert Rutaji, for the votes of thanks. Can we unmute and sing for Dr. Safina a song? Jane, are you going to take us? She's a very good fellow.
Yes, President, willing to serve. And of course, she's from the birthday group Blueberries. So I have the honors to say we join and sing for she's a jolly good fellow. She's a jolly good fellow. She's a jolly good fellow. And so say all over. She's a jolly fellow. She's a jolly good fellow.
One can deny.
Thank you. That choir.
You should have had your voices, that choir, that chorus.
Thank you
so much.
Can't deny
Okay. Let's invite Rotarian Faith to take us through the statistics. Rotarian Faith, you're welcome.
Thank you, President. I have posted attendance in the chat. I want to add my voice to you, my President, to thank everyone that woke up this cold morning to join us and keeping us warm. We had an attendance of 43 Rotary clubs, 2 Rotaract clubs. At the peak, the highest attendance was about 140 participants. That was about 7:30. So thank you so much, everyone, for coming and coming online and attending this fellowship with us. Have a wonderful, wonderful day.
Thank you, Rotarian Faith. Can I now invite Rotarian Betty Tishabe to take us through the final toss?
President Rotarian Betty had asked me to step in for her in case she's not around.
Go on.
Yeah, thank you so much for the opportunity. Thank you so much, the Blueberries, for serving so well, for the wonderful fellowship we've had, for the wonderful presentation by our very own Rotarian, Dr. Safina, and also for the opportunity to listen and hear the voice of our charter president. I give you Rotary International.
Rotary the world over.
For the world over.
Thank you.
Thank you. Thank you, President.
Thank you, Rotarian Ruth.
I now
Welcome,
call this
Doctor.
fellowship to an end.
Rotarian James Onyoin, I greet you.
Thank you for joining us for this fellowship. Thank you, Daybreakers, for attending the
Thank you,
Rotary
President.
fellowship.
Thank you, President.
Can I now invite Daybreakers to stay behind briefly?
I greet Rotarian James Onyoin.
I think he has heard.
Thank you.
Thank
Good
you
morning,
for attending the
Dr.
fellowship.
Rutaji.
Good morning, CP.
My charter president, you are putting me in cloud class. Hey, that appreciation made me very happy. Thank you very much, Dr. Rutaji.
Not just very happy, Dr. Safina, that is you. That's you.
You will unveil the health.
You nailed it. Very, very good session.
That is your knocking style.
And that's the heart of everyone. That's where everyone goes. So it's a point of reference that we really need to know.
He just didn't want to say that word on just your casket. Won't tell you when you're alive. That's it. That's the way to go.
Thank
Appreciate
you.
when people are alive. Yeah,
Not
so that they can
Masimo Genze, Masima Wodi.
Casket.
Can I invite IPP? IPP, are you there? Can I invite you to take us through the program for Saturday? IPP, are you there?
President.
Yes, please.
I am present.
Thank you. You're most welcome. The floor is yours. Take us through the program for Saturday and what you expect from us.
Present.
Yes, please.
Maybe before that, I'm just calling upon the Daybreakers to really send in some money today, because we are a bit stuck. We want to pay the service providers and so on, but we have done around 50%. So we really need the other 50%. Those who have pledged and have not yet fulfilled their pledges, kindly send through. And those who have not yet sent in anything, please I'm calling upon you to send some money today. Thank you.
Thank you, Queen Esther, for that information. Over to you, IGG, IPP.
Promoted to IGG.
But we also have the IGG.
President, I still see other non-breakers on call. I don't know whether.
I think there's no problem.
Maybe
They are well wishers.
maybe it's okay to have them.
They are well wishers. They can support the backup.
Yeah.
They are members of the family.
You end up missing big coffers.
So,
them away.
Hey. Let them support the backup project.
Everyone is invited.
You end up missing big coffers here.
Yes. Okay, over to you, IPP.
Okay, President, let me straight away go into the activities of the day. In a minute. All right. Okay, I'm going to share. Let me share the program of the day so that members can appreciate. Oh, President, you're already sharing, is it?
No. Can I? Is there anything I'm sharing? No.
Let me share. Let me share. Are you able to see?
Yes.
Yeah.
Yes, we're able to see. Okay, friends, good morning once again. As you may know, this Saturday, we shall be launching our activities. It's not the Big Up program launch because that was already done by the district, but it's our activities in implementing that program that we shall be launching at Kazo, ECD, and Youth Resource Center. Kazo ECD and Youth Resource Center is a facility that was established through partnership with IRID and other partners. We lead Uganda Kingdom that established that facility, and they will be the ones to host us. I'm in touch with the head teacher. I'm actually meeting them today to finalize, to work out the final details of the day's program. It will start off with registration and welcome, which will be led by the committee, led by our service projects director, Amazing Amanya, and the club president will give a welcome note at the end of that, and then we shall then go into the launch initiative, the launch activity. We shall kickstart our launch activity, and the proposed the proposal is to I've opened the detailed one, which ideally is for the MC. I think it's better to show the detailed one. Are you seeing the detailed one? I've closed off the PDF.
Not yet.
Okay, let me just go. Let me close this and then I open the detailed one because it gives it a little bit more into what the detailed of the day. Okay. Sorry. Okay, here is the detailed. Are you able to see it?
Yeah.
Yes.
Yeah, this is the detailed one, which goes a little bit into the detail of the day's activities rather than the outline. So it starts off with the registration of attendees, and then we shall be helped by our Rotary actors. I've talked to the HCP of our Rotary Club of Mulago, School of Nursing and Midwifery. They will be able to, they'll be present to partner with us in that launch. So they will help us with distribution of these materials. And then at the end, as I said, there will be some welcome remarks. Now, this will lead us into the actual now opening of the launch day by start off with the words of the grace and the singing of the national anthems, the anthems, which I presume will be the national anthem and the Buganda anthem to recognize that this Kazo ECD is a partnership with the Buganda Kingdom. We shall have 10 minutes where guests will be introduced, and then we proceed into remarks from the host school, which is Kazo, remarks from IREAD, overview of the recap program. This one will be given by our district BCAP chair. We shall have a keynote address by our guest speaker, who is none other than Dr. Grace Bikumbi. This is one of our launch. Dr. Grace Bikumbi will be our guest speaker for the day. And what he'll be talking about is one of the activities within our BCAP program activities, and that is to do with mental health. So he will be talking about the struggles that the boy child, confront when, as far as substance abuse is concerned, and we'll also be able to explain how Rotary can help or how Rotary is helping. After that, there will be now the presentation of the BCAP service projects or service activities by the BCAP ambassador. Unfortunately, I won't be present. However, Amazing Amanya has offered to step into the shoes of the BCAP ambassador on that day. So there we shall explain the various activities that we would like to do as part of the implementation of the BCAP program. After that, after unveiling those, we shall call upon our guest of honor, who is the district governor, to officially launch our BCAP projects. As part of that launch, the official launch of 30 minutes period, we will request those who want a photo moment with a DG to contribute towards our service projects by giving 100K, or just if they want to pause, we shall have some sort of a board which highlights our various initiatives for BCAP, and somebody who would want to pause with the president or pause with anyone else, they contribute 50,000, which goes towards supporting our BCAP initiatives. So I need also to mention that as part of this, Rotarian Grace has mobilized some of his colleagues. So we shall have a workshop on mental health at the same time, which this is going to be running alongside the launch activities. And so it's again during this break that the governor will be taken around and interact with those that will be conducting the workshop. At the same time, there will be a music interlude in those 15 minutes break, and a poem. There will be a reading of a poem by one of the students that will join us from the partner schools. We have a total of 4 partner schools that are going to be part of us on Saturday. Certainly the host is one of them. Then we have Katwe Primary. Then we have, I forget that name. President, you remind me that name along Bombo Road. Then
St. James Kawanda.
That Kawanda Primary School, the Nemasoli Primary School. During the networking and refreshments, which is about 30 minutes, there will be opportunities for members to network and engage in discussions as they enjoy their refreshments. And the DG will also have the opportunity again to tour around, greeting and talking to those that have come in to join us. Closing remarks will be, he will make his final closing remarks. After that, we'll give him 10 minutes to give us his closing remarks. We do think that this time is enough for him to get get a clear idea of what we are trying to do, and then give his input into our program, which could be words of advice, words of encouragement, or whatever comes to his mind. We give him that time to give us those closing remarks. The vote of thanks, Service Projects Director will give a vote of thanks, and then certainly that sort of starts us into the closing, closing of our launch. At the very end, we shall have an opportunity to take photos with the guest of honor, the president, district leaders that may be present, and participants. We shall have photo opportunities at that close. After that, we hope that by noon, we should be ready to leave the venue and proceed into our day's programs, the rest of the day's programs. President, in brief, that is the agenda for the day.
Thank you, IPP Edward, for presenting to us that elaborated program for the day. I am already excited for the day. I believe the day is going to be a marvelous day. Members, over to you. Do you have any questions? Rotarian Esther presented before IPP, and the program is before us. Please have any question across the two. Thank you.
President.